Thank you very much, Mr. Speaker. Mr. Speaker, I rise to present my analysis of the budget speech, current and capital revenue and expenditure for financial year 2013 under the theme, and I quote, "Overcoming challenges together, accelerating gains for Guyana," unquote. Presented by the Minister of Finance, Honorable Member Dr. Ashley Singh. My presentation will focus primarily on the health sector, which falls under sectorial developments and the agenda for 2013. Mr. Speaker, Guyana over the years since gaining independence status some 4 to 6 years still encounters major challenges in all spheres. As it relates to health, our people, more so the underprivileged, elderly, and vulnerable groups, continue to experience challenges. Article 24 of Guyana's Constitution clearly states, and I quote, "Every citizen has the right to free medical attention and also to social care in case of old age and disability," unquote. Mr. Speaker, I know there are those who will agree with me and those who would not. Guyana continues to struggle among CARICOM countries to rise from just above Haiti. Our country does not have the accountability framework to make all our achievements sustainable. When it has been the legitimacy to enforce regulations, it has been the majoritarian arrogance in not recognizing that accountability relies on impartial and unbiased enforcement of all rules and regulations. On Monday, 25th of March 2013, we all sat in this Honorable House to hear the Honorable Minister in his usual rhetorical manner outlining what the economy is likely to achieve within the fiscal year. Mr. Speaker, there is not one single determinant in these estimates under the health sector which can convince me that year 2013, Guyanese who are reliant on the public health care systems will have access to the quality of professional health care that their tax dollars should afford them. Mr. Speaker, I am disappointed in the manner in which the budget speech was crafted. For me, it lacks specificity and relevance in health needs for all Guyanese. The National Health Sector Strategy has indicated that there are 4 goals of sector development. 1, equity in distribution of health, knowledge, opportunities, and services. 2, consumer-oriented services, people-focused and user-friendly. 3, higher quality services and good value for money. And 4, accountable providers and government. To achieve these broad sector goals, the NHSS 2008 to 2012 focuses on achieving strong organizations and built-in incentives to drive change. The sector strategy is divided into 5 main components, and I will just, for the sake of time, list them. Decentralization of health services providers. 2, strengthening the skilled workforce and human resource systems. 3, strengthening government capacity for sector leadership and regulations. 4, strengthening sector financing and performance management systems. And 5, strengthening strategic information. Mr. Speaker, I would like the Minister of Health to say to this nation, what are the successes and shortfalls in achieving those objectives as outlined in the NHSS? Mr. Speaker, I have reviewed the following years, 2010, 2011, and 2012 budget presentations and compare them with 2013. What I found most amusing is that there has been no significant changes regarding the contents of those presentations, except to say that there has been significant increases in figures. The Honorable Member, Dr. Singh, alluded that government remains committed to ensuring our citizens have access to high-quality healthcare services, and in 2012, some $17 billion was expended. Mr. Speaker, what is concerning to me is that the government continues to boast of improved facilities within the health sector. However, the National Health Strategy for 2008-2012 has been exhausted, yet none has been tabled in the National Assembly. This should have been given urgency since it was common knowledge that the life of the document was soon ending. However, we are here to take a close examination of the improvements of this sector under discussion. One can see that year come, year pass, there is absolutely nothing significant to boast about, since billions are given to infrastructure while our citizens continue to receive unprofessional service and treatment at the hospitals. They are forced to wait long hours before they are seen by a medical practitioner. The unavailability, or in some cases limited supply of pharmaceutical drugs, continuous deaths of potential mothers, and in some cases their unborn. Citizens are given expired drugs, and as I'm on this point, sir, it was reported to me that on March the 18th, 2013, a drug, I think it was manufactured on the 13th of January 2011, and it was expired on the 1st of January 2013. That expired drugs was administered to a patient at West Demerara Regional Hospital. Mr. Speaker, my own experience, in December of 2012, I personally visited the Georgetown Hospital when my grandmother took in that Sunday afternoon. And Mr. Speaker, I had to wait long hours. We got there at 2:45, and she was admitted, I think it was 1:45 the Monday morning. She eventually succumbed. But, I mean, I just used my personal experience to show what our people are suffering whenever they visit the public hospital. The big question here, are gynaes truly getting value of service at these public institutions when they contribute tremendously to our tax system? My answer is a simple no. Examination of estimates. Mr. Speaker, an examination and assessment of the current and capital revenue and expenditure for fiscal years 2012-2013 was done. It was established that in 2011, $150 million grant was budgeted for the preparatory studies and designs of a 150 specialty hospital bed. Specialty hospital. It was reported that in the Honorable Member's budget speech of 2012, that in 2011, and I quote, furthermore, $29 million was expended towards land preparation works for the construction of a new state-of-the-art specialty hospital. Mr. Speaker, I have before me the relevant facts to show that to date, works have not commenced on that proposed site. For fiscal year, I'll get to my presentation about the thing that I want to really show. For fiscal year 2012, the sum of $672.54 million was allocated for designs, construction, and equipping of the 100-bed specialty hospital. in 2013, the honorable member in his budget presentation stated that a total sum of $1 billion was spent to expand, upgrade, and maintain the infrastructural facilities of the sector, including a mobilization payment for the state-of-the-art specialty surgical hospital at Lindal, which will afford Guyanese the opportunity to access specialized healthcare services, upgrade of the National Psychiatric Hospital, and the Georgetown School of Nursing and construction of the Port Morant Health Center. Mr. Speaker, as I said before, $1 billion was spent to expand works at the National Psychiatric Hospital. When we look out of these walls from this National Assembly, we would see mentally challenged women and men roaming our streets. Our citizens have been attacked by these people, and yet this government keeps saying or keep reporting that monies and upgrade works would have been done at the psychiatric hospital, and to date, many of our mentally challenged people are left to roam the streets. What exactly is this government saying to us or to the people in this country? Or where has the money gone? In which other area? Mr. Speaker, I made reference to the specialty hospital. This is what the Honorable Minister of Health would have reported after an article was carried in the Stabrook newspaper dated January 8, 2013, hive of activity at specialty hospital site. This is what the minister said. Government is responsible for preparing the site before the building of the 180 million US specialty hospital. Contracts worth $98 million were awarded to G. Boville Construction Company back in January of last year to begin preparatory work. The duration given for the completion of the site preparation works was slated as 3 months. Mr. Speaker, this is what the Honorable Minister of Health would have reported after, I guess, the article would have made public. Pre-construction works begin on the state-of-the-art specialty hospital. This was carried in Stabrook newspaper dated Saturday, 14th of July. The land preparation process for construction of the multi-million-dollar specialist hospital at Lindal, East Coast, Demerara, has begun. These are the words coming out from the Honorable Minister's mouth. And works are moving apace, despite negative talks by some sections of society. But let me remind the Honorable Member, in his budget speech last year, when my Honorable colleague here, Moses Nagamutu, would have presented evidence to this House about the proposed site being good, more or less festive with grass. This is what the Minister of as of the 15th of March, it was reported, this is what the Minister of Health was more or less saying, that was even before those pictures were taken, that the Honorable Member, Mr. Nagamutu, was bantering about some 10% of the preparation of the site and had been done. This preparation includes the construction of fences, the digging and construction of drains, internal and external sturdy bridges, and so on and so forth. So I would like to inform through you again, Mr. Speaker, that it is not becoming to impart misinformation on the nation using this forum without knowing or unwillingly to make oneself knowledgeable of the facts that, of course, those pictures are misrepresentative of. But I have news for you, Honorable Member, because, Mr. Speaker, as of the week of March 25th, 2030, this is what the proposed site looks like. And I'm going to have just a set of sand. There is one, I think we call it a drag line. They talk about bridges, sturdy bridges being built. There is no evidence of bridges being built. They talk about drains being dug. There is nothing of that sort. So, Mr. Speaker, as the legislative branch of government, this is taxpayers' money, people's hard monies that are being used, deducted from their salaries. And this minister would have made it public. Or the Honorable Minister, thank you for correcting. Mr. Speaker, the very article in the 14th of January newspaper, here this is what the Honorable Minister of Health said. A $97 million contract has been awarded to G. Boville Construction Company Limited to grade and fill the land, construct a fence, bridges, gates, culverts, and access road, and install utilities. $97 million of taxpayers' money were utilized according to the minister. So, Mr. Speaker, these questions must be answered. What did the $97 million use for? When, according to the minister, that these works were done based on the monies awarded to G. Boville Construction Company. Mr. Speaker, I'm eager to see what the responses would be like, since these monies are debited from the citizen's salary and credited to the tax system. Anticipating that answers will be given, permit me to remind and inform members of this National Assembly on the following. Mr. Speaker, well, I would have already shown the portraits. After 2 months, this is what the site looks like. Mr. Speaker, I'm wary of how the people's money is being utilized. Therefore, and I repeat, therefore, I am calling on the minister responsible to explain to this National Assembly why works have not commenced and what has become of the sums allocated from last fiscal year's budget. Mr. Speaker, the President in his address to this National Assembly on the 10th of February 2012 said, and I quote him, "Already we are investing in a new and modern hospital in Guyana. This will give us the ability to deliver certain services at a fraction of what it will cost elsewhere in the region and further afield. We hope to have this modern facility within the next 5 years." With these few words said in a positive tone, we can only hope that this is realized. From all angles, in my own judgment, another election will come and this project may still be an embryo. Mr. Speaker, what is even more surprising in the Auditor General's report for fiscal year ending 31st December 2011, no mention was made of the works to which I alluded to earlier. As a legislative body, the onus is on us to ensure that systems as per law are enforced. Regarding works at the Georgetown School of Nursing, it has been reported that works commenced sometime in the latter quarter of 2012 on the building. But honorable members, I have news for you. Because what was brought to my attention, Speaker, to the existing building there in East Street, Georgetown, this is a structure that is being added. And this started sometime in the latter part of 2012, when we would have approved allocations, I think in $25 million. The work commenced latter part of the quarter in last year. Mr. Speaker, what is interesting to note is the estimates of fiscal year 2012. The sum of $25 million was budgeted and approved by this National Assembly for the following payment of retention and rehabilitation of Georgetown Nursing School, to be done as per project reference 197. In contrast, for the current fiscal, it has been recognized that a sum of $25 million has been budgeted for allocation in order to effect the following. Remember, last year was to pay retention fees and rehabilitate works at the Georgetown School of Nursing. Here, in this year's budget, another $25 million to pay retention fee, extension of nursing school at East Street, and rehabilitation of annex at Kingston Nursing School. Therefore, the sum of $25 million is being sought in fiscal year 2013 to defer expenditure in these three areas. While on the other hand, the same amount was sought and approved, as alluded to earlier, in 2012. To reinforce my argument, this sum was for retention fee and rehabilitation work at Georgetown School of Nursing. Mr. Speaker, in reviewing capital expenditure for fiscal year 2011, the sum of $900 million was budgeted to procure generators for the Georgetown School of Nursing, New Amsterdam, and Linden. My investigations have revealed that the item, I can only account for the Georgetown School of Nursing, was never procured and installed at the Georgetown School of Nursing. The National Assembly should call on the relevant ministers to state why the generator has not been installed as approved, whether generators were purchased for the other areas. If not, what has become of the funds? Mr. Speaker, the Honorable Minister of Finance has reported that government proposed to invest $369 million for human resource development. This has been a projection of 4.6% with a reduction for training as compared to the account budgeted in 2012, which was $387 million. Emphasis must be placed on training and development of our people within the health sector. Since the Guyanese expenditure, Mr. Speaker, my other colleague, Dr. Norton, he is going to cover what I would have missed. But let me just emphasize this. Mr. Speaker, in a letter carried on March 21st, as in Culture News, Wakenham residents are receiving primitive treatment. This is what the writer had to say, Mr. Speaker. The hospital has no proper equipment to provide health services. Many times, patients are referred to West Demerara Hospital, which has proven to be very costly, risky, and fatiguing, notwithstanding the fact that no electricity is also a reason for such referrals. Mr. Speaker, as I said earlier, the budget presented under the health sector is more or less a budget that deals with infrastructure works. I don't know how the government sits and put the budget together. Apparently they do not take into account the other needs. I mean, apart from buildings, people want to ensure that whenever they turn up at public health institutions, they must be treated properly. Mr. Speaker, in another article, this is 3-year-old heart patient, a survivor. This is what his mom had to say. It was carried in Culture News dated March 21st. Nonetheless, Farad's family was devastated. His surgery could not be facilitated here in Guyana. He needed to go to India. This is where the Three Rivers Kids Foundation, a Canadian-based kids charity foundation, came into play. From what I gathered here, Mr. Speaker, apparently, and I can be corrected, this government did not contribute or stand the necessary expense to help 3-year-old Farida Ali. At the hospital, in concluding, Mr. Speaker, the only way Guyana can overcome challenges and have its gains accelerated is that political players should put aside partisan politics and work together towards the development of Guyana in order to improve the lives of its citizens. Government must embark on ensuring that goals set out in the Millennium Development Strategy to be achieved by 2015. However, within the health sector, emphasis should be placed on goals 4 to 6, since the health sector continues to face challenges. In my opinion, infrastructure should not negate the need for adequate human resources to achieve given objectives. Therefore, I am challenging the government to ensure that focus should not only be placed on training, but retention of suitably qualified staff. And you know that's a big thing in the health sector. The nurses are calling for better remuneration and incentives. For Guyanese to enjoy a good life, the APNU had outlined a number of measures towards the enhancement of the health sector. However, we continue to place on record that there is urgency to strengthen the delivery of primary care services in general, more particularly to meet the needs of remote communities, including environmental surveillance. The APNU would welcome the following: strengthening the procurement practices utilizing objective scientific tools and increased oversight on the sufficiency and quality of the consumables. Encourage the use of private medical insurance by providing tax rebates for medical care. Mr. Speaker, I therefore challenge the government to consider these measures, since they will work in the interest of Guyanese, especially those contributing to the tax system. I rest my case. Thank you.